pain that's on the back side of the knee, especially if you try to straighten your leg or if you're going downhill, either walking, running, or going downstairs? If so, it could be coming from the popliteus muscle. Hi, welcome to the Body Shop Physical Therapy. I'm Dr. Catherine Price. I'm a physical therapist, and in this video, I'm going to go over trigger point release of the popliteus muscle. The popliteus muscle is a little muscle that goes behind the knee. And before I begin, I want to speak a word of life from Psalm 37:4. Delight yourself in the Lord, and He will give you the desires of your heart. Knee pain is no fun, and sometimes if you have knee pain in a crouched position, or like I say, going downstairs, going downhill, and it's on the back side of your knee, that popliteus muscle, it's a small muscle, and it's going to originate on the upper portion of the back side of the shin bone, that tibia. So on that back side, if I bend my knee, you're going to have this nice tendon here. That's your semitendinosus. And if I follow that down, I'm then also going to feel kind of its attachment, and the inside of the gastroc is going to also cross over there. If I kind of move that tissue away and go deeper into that, that's where I'm going to see or feel the origination of the popliteus. And then it's going to go behind the knee and then come around and attach to the end portion of the femur on that lateral condyle, but it's also going to blend in with the arcuate complex, which is going to be an attachment point that blends with the meniscus, and that's the cushion of the knee. So it goes from the upper portion of the lower leg and then goes across and attaches onto the outside of the knee. And its job is to unlock the knee when you're walking. So when I am bending my knee and I'm first making that movement, that muscle is going to be activated. And then it is going to turn in the lower leg if my thigh is fixed. And if my foot is planted, it's going to rotate my femur externally. And so there can be trigger points in this muscle if you are downhill running, or if you put weight on a bent knee, sometimes that muscle can develop trigger points. And if you do have trigger points in that muscle, it can be painful to extend the leg fully. Now, it usually does not occur in isolation. So if you do have problems with that popliteus, you want to check the biceps femoris, which is the outer portion of the hamstring, the lateral part of that hamstring muscle, as well as your gastrocnemius muscle. So that's going to be the calf muscle. So those two muscles are usually going to go along with the popliteus. If I do have and want to investigate my popliteus, what I'm going to use is a single lacrosse ball in order to release the trigger point on that popliteus. Now, your popliteal artery is on the backside of the knee. You don't want to put pressure on vascular supply. So if you feel a pulse, then you want to stay off of that. So what I'm going to do is first follow. If I see, this tendon here, my semitendinosus, part of the hamstring, and it's going to attach down into the medial tibial flare here, but I'm going to go on that back side and push my calf away and then press in, and I'm going to find the popliteus muscle there. So what I'll do is then take the lacrosse ball and I'm going to apply pressure onto that area, and then I will put my body weight and I'll bend my opposite leg. So let's do this on this one so you can see that. So I'm on the inside. Can you see that? So I'm going to be on the inside. Let me switch legs. So it's on the inside upper portion. I'm going to go just kind of on that, not directly on the back side of the knee where my vascular supply is, but I'm going to start on the inside. And then I'm going to lift my body and put some pressure there. And then once I find any areas of tenderness or tension, I'm going to slowly move the lacrosse ball side to side, or my leg side to side. And that's just going to allow me to find some of those areas. Once I do that, I'm going to just hold on that and let that tenderness or tension start to subside. And I can work on this for about 2 minutes. Once I have released the trigger point in the popliteus muscle, I then want to stretch that muscle. And I'm going to do it. I'm going to do that by taking my knee and I'm going to bend it. So I'm going to bend it about 15 degrees, 15 or 30 degrees. And then I want to take my foot and turn it out. And when I do that, if it's really tight, I may feel a stretch back there. And I just want to hold for about 15 to 20 seconds and then relax and then turn it out again and hold till if I can get a stretch, great. If it, like I say, if it's really tight, you may feel a stretch in there, and hold that for 15 to 20 seconds and then relax. Then I can go back and check and see if I still have some more tenderness in there, work on that popliteus. And again, it's on the upper portion of the backside of that shin bone. So if I'm going back behind there, and I'm more on the inside when I am on that shin bone, and then applying pressure there and go back to that, work on that trigger point, and then bend the knee about 15 to 30 degrees and take my foot, turn it out to the side, and then hold my thigh still. And I'm looking for a little bit of a stretch in there. Hold it for 15, 20 seconds, relax, and repetitively do that. So that is how I will release the trigger point in the popliteus muscle and then stretch it. And then after doing that, if you've had pain when you straighten the leg, when you then go to straighten it, you should be able to straighten it with less pain. So it's always good to have an evaluation from your medical doctor or physical therapist to find out what the pain in the backside of the knee is coming from. It just may be the popliteus, but it could be some other source as well. So I hope this is of help, and have a blessed day.